I'm Dr. Haley Todsen, a board-certified emergency physician practicing for 20 years, a Menopause Society certified practitioner, and the founder of Optimize Integrative Health.
My name is Bailey. I am the family nurse practitioner here at Optimize Integrative. I have 7 years of experience in the medical field. I am functionally certified, and I love focusing on longevity within this practice, and we hope you enjoy this podcast. If you are a female in your 30s and 40s and severely struggling with sleep, most specifically waking up between 2 and 3 a.m., not able to go back to sleep, this podcast is for you. Today we are going to be talking about all things progesterone because that is likely what it is, but needs to be determined by a physician or someone going over your lab work with you. So again, if you're waking up between 2 and 3 a.m., you feel like you're wide awake, you could just get up and get moving with your day, your heart is racing, you have an increase in anxiety, this could be progesterone. So we've talked in the past about perimenopause, and that starts 7 to 10 years before you reach menopause, and these symptoms are usually the first that start is the sleep disturbance. And it's usually because progesterone is the missing piece. And just to give a little background on progesterone, you have it your whole life as long as you are getting normal menstrual cycles. So the main purpose of progesterone is reproduction. And I explain to my patients, progesterone is the progestational hormone. It is what supports the pregnancy when until the placenta is fully formed. And what happens is once you ovulate, your progesterone starts to rise in anticipation of a pregnancy. And when an egg is not fertilized, then all of the hormones crash and the progesterone comes back down. If a woman were to get pregnant, then the progesterone would continue to rise at an exponential rate to support the pregnancy. So that is why I tell people in the first 2 trimesters of pregnancy, that's why you're getting the most amazing sleep, you're tired, you want to nap, your skin starts glowing, your hair looks beautiful, it's the progesterone. And then we'll be talking about how later in life, how the progesterone contributes to, or the lack of progesterone contributes to poor sleep and increase in anxiety.
You're exactly right. So it has the most amazing effects for pregnancy, but then when you're in perimenopause, we see the fluctuations of the progesterone. The progesterone is known as the calming hormone, and it is the precursor to allopregnanolone, which then causes GABA to release neurosteroid transmitters to the GABA to therefore cause calming, decreased anxiety, sleep benefits. And so during perimenopause, when we get the chaos of this hormone, we don't ovulate, we then have the lack of the progesterone causing, like you said, the wake-ups, the anxiety, the mood fluctuations, sometimes the hot flashes at night. And so really knowing what this hormone is doing can explain your symptoms. And we see this very frequently occurring in our perimenopausal patients.
Absolutely. So, and circling back to the sleep disturbance, if a woman is waking up between 2 and 3 a.m., it could be a lot of different things. So number one thing we look at or we attribute it to is that decline in progesterone and those hormone fluctuations. So perimenopause leading up to menopause can be irregular ovulation, which will interfere with the levels of progesterone in the body. Also, if you are having hot flashes or night sweats while in sleep, that could be another perimenopausal issue contributing to this as well, which progesterone can sometimes help, but sometimes estrogen is needed, but that's not what this episode is about. Also, cortisol, your cortisol levels. So when a woman is in her perimenopausal period, which again, 7 to 10 years it can last, your whole metabolism changes, your whole ability to manage stress changes. So another thing that could be contributing to your poor sleep is not just progesterone or estrogen, could also be your cortisol levels which should absolutely be looked into if you think that's a contributing factor. Also with the blood sugar dips, so it could go really high or really low, because again, when you're approaching menopause and you're in that perimenopausal stage, your metabolism changes, which refers to your ability to handle blood sugar and the ability of your body to use that blood sugar. So that's where this could be where a lot of women start gaining the weight, not just from the lack of sleep, but also your body's ability to handle blood sugar, which can also interfere with sleep. So again, when your sleep disturbance increases during this menopausal transition, one of the most common complaints is the nighttime awakenings, which number one thing we will add in is progesterone. So that's just typically what we look into after doing our intake process, looking at hormones. It's usually progesterone.
And then obviously there's studies to back this. So in randomized trials, we know that progesterone was really important in helping with the night sweats, with the wake ups, and with the mood changes. We also know that it can help with insomnia, particularly if you're lacking obviously the progesterone. So there's many benefits from this. And like you talked about, this is not a one size fits all. We look at these levels in menstruating women to see if they are low. We do supplement, that's one of our first supplements that we do use in perimenopausal women, and we see such amazing benefits even after 2 weeks of being on this. And so it is so important to look at the whole body and look at why is that happening at 2 o'clock in the morning. Is it the insulin? Is it the cortisol? Or is it perimenopause with the progesterone?
Yeah. And even just adding in that progesterone, a lot of people are very apprehensive when I do mention progesterone, because it is referred to as HRT, hormone replacement therapy. But what I want people to know about progesterone is that it is the most low risk hormone you could possibly go on, and it will reap the most benefit, because we're very passionate about longevity. If you're not sleeping well, it's going to affect everything else in your life. It's going to affect your gym recovery. It's going to affect your mood. It's going to affect your metabolism. So taking progesterone could really be that one thing that can help with all those other things. And it has a very low side effect profile. We start very conservatively with our women. I think a lot of mistakes that other clinics make is that they just start them too high, which can lead to some side effects like excessive daytime sleepiness the next day, or breast tenderness, or water retention. But our patients tolerate progesterone so well because we start low with them, and then we find their personalized dose as time goes on and make those tweaks between our appointments. So again, and it might just not always be the progesterone. So you also have to look at your sleep hygiene. So what are you doing before you go to bed? Are you scrolling on your phone? Are you watching TV? Do you eat late night dinners? Are you very stressed out when your head hits the pillow? So that's just another thing to consider if sleep is not going well for you. Also want to look at your bedding. If you are getting more hot at night and that's contributing to your lack of sleep, you could switch to cotton sheets, or get an 8 sleep or a bed jet, which blows air under your blanket if you're getting hot. And then also, doing things to wind down before bed. I don't know if you have anything to add.
Yeah, so one thing is we do personalize this. So we have different routes, different doses. So we can tweak this. We have tons of room to move on this. And so we love working one-on-one with our patients because of this. We never want them to give up. We can decrease, we can increase. It's just personalized, right? Yeah. And we have a lot of hacks between the bedding that we like, right? The bed sheets that we like, the temperature in the room. We have a whole sleep cycle that we work on with patients to make sure that they're optimizing in other ways when adding even the progesterone. And so that is so important to actually look at the entire protocol instead of just adding progesterone for sleep.
Yeah.
And then, so if you are dealing with the 2 to 3 a.m. wake ups, the night sweats, the anxiety, the mood swings, the irregular periods. This could be your physiology. We look at the cortisol, different markers along with this to make your individualized plan and treat you as a whole person. If you have any questions or want to learn more, contact us at optimizetampabay.com.
This podcast and all related content are provided for educational and informational purposes only. Nothing discussed on this show is intended to be, nor should it be interpreted as, medical advice, diagnosis, or treatment. No doctor-patient or provider-patient relationship is created by listening to this podcast, watching this video, or engaging with any of our content. Although I am a licensed physician and Bailey is a licensed nurse practitioner, we are not acting as your personal healthcare providers in this setting. The information presented is general in nature and may not apply to your individual medical situation. You should not rely on anything discussed here as a substitute for professional medical care, diagnosis, or treatment. Always consult your own physician or qualified healthcare provider regarding any medical condition, medication, supplement, or health decision. Never disregard or delay seeking professional medical advice because of something you heard on this podcast. Optimize Integrative Health, its clinicians, and its affiliates expressly disclaim any and all liability for actions taken or not taken based on the information provided in this program.